Ovitrelle is a medicine used in women who have received treatment to stimulate their ovaries, to trigger ovulation, the release of an egg from the ovaries, and the development of a special structure on the ovary, the corpus luteum, that helps pregnancy. It can be used in women who are undergoing fertility treatment, such as in vitro fertilization, and in women who are anovulatory, do not produce eggs, or oligoovulatory, rarely produce eggs. Ovitrelle contains the active substance, choriogonadotropin alfa. It belongs to the sex hormones and modulators of the genital system. The marketing authorization holder of this medicine is Merck Europe BV. Ovitrelle can only be obtained with a prescription, and treatment should be carried out under the supervision of a doctor who has experience in the treatment of fertility problems. Ovitrelle is given by injection under the skin. A dose of 250 micrograms is given 24 to 48 hours after the ovaries have produced follicles that are mature enough, eggs ready for ovulation. In women undergoing fertility treatment, this is generally 24 to 48 hours after stopping treatment to stimulate the ovaries, such as with a follicle-stimulating hormone, FSH, or human menopausal gonadotropin, HMG, medicine. The woman or her partner may carry out the injection if they have been trained to do so, and have access to expert advice. For more information about using Ovitrelle, see the package leaflet or contact your doctor or pharmacist. The active substance in Ovitrelle, choriogonadotropin alfa, is a copy of the natural hormone human chorionic gonadotropin, HCG, also known as the pregnancy hormone, which helps to maintain pregnancy. Because of its similarity to luteinizing hormone, LH, Ovitrelle is also used to trigger ovulation. That's all information we collected. Do not forget to like, share, and subscribe for HeInfo channel.